Hello, my name is Dr. Scott Young, and today we're going to talk about, can I be too old or too young to get hearing aids? Really? Coming right up. So when you ask this question, I hear this all the time. I'm too old or I'm too young to get help with my hearing. I had a physician of mine, a friend of mine, very close, and he's like, I feel like I'm too young. And I said, well, you know, you're 52 and I'm 54 and I've been wearing hearing aids 9 years or 10 years, something like that. Oh, well, I guess so. I guess it's not that bad, is it? Here's the thing. I want to share with you of the youngest and the oldest patients that I've ever done. The youngest I ever did is a 6-month-old. 6-month-old, this was, I remember very clearly, I was in my internship back in University Hospital in Denver. And we had a patient that we were working with the family, and I noticed that she was looking at my arm as I moved my arm into different positions. And we were doing this called a VRA. It's a different type of audiometry. We're trying to find out the responses to little squeaky toys. And she was watching it and she would look over here and see that. And she was looking toward that. And that was a 6-month-old we actually fit with hearing aids. There are lots of pediatric audiologists that fit very young ones with that. The oldest patient I ever did, the 101-year-old sister brought her in who had pretty darn good hearing. And her older sister was 105 years old. Now we have different technologies, and one of them, she was choosing between a couple different types of technologies. And we really kind of moved this toward your very quiet lifestyle or your quiet lifestyle. And she was kind of in between because she still liked to get out with people. And here's the thing that we were laughing as we talked about this. I said, in the very quiet lifestyle, you're going to have a 1-year warranty, and all the services are no charge for the life of your hearing aids, and we have the 1-year warranty, 1 year of batteries. On this one here, we did 3-year warranty and 3 years of batteries. And she just looked at me. She goes, "Do you think I'm going to be around for 3 years?" It's like, look at her now. How do you actually say that with a 105-year-old woman? Now, she could, okay. But here's the amazing thing. She was living her life 1 year at a time, and I completely got it. I completely understood, and we were all laughing about it. She had just great attitude about her life. We have patients who come in through the Department of Rehab Services. This is you gotta have this interesting part. In FDR's time frame in the 30s, when we were going through the Great Depression, there were people who would have an arm completely destroyed by an industrial accident, and they couldn't work anymore. What FDR did through his policies is created vocational rehab, so they would train that person to do maybe some other office job. Excuse me. And so the Department of Rehab Services is that vehicle. And patients will come in because of that. So for instance, I always have this powerful patient. One of my very first patients I ever did with Department of Rehab Services was a security guard. Now, there was 2 different levels of the security guard, and one was making, this is a long time ago, $6 an hour, but the next job up was $8 an hour. And he wanted to be able to do that, but he couldn't do that unless he could answer the phone. Now, because of his hearing loss, he really couldn't hear and understand on the phone. And so it was a powerful process to be able to get some help with his hearing. And the Department of Rehab Services would help him. And that's something that we work with. That's a person who's working age and can be able to do something. And so we got him in the help, and he was able to pay more, get a better job and pay more in income taxes. Well, that's a bonus for the state overall. That's a long-term benefit. And so we see a very strong correlation in there. Now, one of the things that happens, and you ask the question, what are we seeing for patients? We're actually seeing younger and younger patients. And people say, why is that? When I was first studying about audiology in the 80s, we were talking about the old idea. The pre-antibiotic era was around the 30s and earlier. In the 40s, really, we were using much more antibiotics and stronger ones that would really help us. Did you know that people who have ear infections, kids get ear infections all the time, but even adults have ear infection issues. And people who have ear infections were dying of their ear infections. What happens is that the infection would get into the meningeal layer, which is this layer that is around your brain. It would infect it, turn up the temperature up to 105 decibels, burn out the brain cells, and the person would die because they were infected all the way through and through because there was nothing to kill it. And once we've had patients who have gone through their infections or other types of medical treatment, including burn units. We used to work on a burn unit, and I'd had this patient, these patients with massive burns, and they were having the really hardest drugs to keep them alive. Well, guess what those drugs will do? It's called ototoxic reaction. An ototoxic reaction is going to create sensory deprivation. They're going to feel neuropathy in their hands, their vision probably is going to be worse, their sense of smell, their taste issues, and again, their hearing. And so it can cause all kinds of problems to that. And that's why we see more and more ages out there. So I hear this all the time, and physicians just unwittingly are trying to present an idea that you're normal for your age. A gentleman will walk in, he's 81 years old, and he's normal for his age. What they're looking at is they're not looking at the hearing loss. What they're thinking about is his ability to kind of communicate a bit. Let's say you and I are sitting with a Slurpee. Now maybe you don't like Slurpee, but just get anything you want to. We're in a mall together, and we're sitting there looking at people as they walk by. And we're trying to evaluate if that person has a hearing problem. Now, most of the people you would see, they walk by and they can communicate. And then you see one or two in that group, maybe a 10 or 20% of the people who cannot understand the conversation. You go, that's a person with hearing loss. What you're identifying is a severe to profound hearing loss. Because in that mall, I mean, even though it's a complicated listening environment, even a person with a mild hearing loss is sort of getting by. Sort of. And so the reality is that we think hearing loss is either normal or they can't hear. And so we think, I can still hear. And so it becomes this issue of, do I really have a problem? Should I worry about it? And I just did this with a patient of mine. She's much younger than anyone you can see, and I'm going to show you this. This is my red hearing aid. And I wear a red one because I want to show it isn't that big a deal. This patient I just fit here the other day, she's got blue ones. We have people that have camo hearing aids. And this is actually done by Resound that has gorgeous colors that we have out there. The reality is, guys, here's what happens. If you're thinking, I'm too old, well, do you really want to communicate with people? Do you really want to understand what they're saying? Is that important to you? And as we get older, communication is much more important to us. Oh, I'm too young to get help. Well, do you really want to have an average of $30,000 less in earning capacity for those who have hearing loss? It's illegal to fire someone over disability, but I can't tell you how many times that employers have let someone go because of one factor. They didn't listen to them. See, the difference between listening and understanding is not known by the receiver or the speaker. They can't tell if someone's not listening or not hearing or understanding. The reality is, if you can't listen, you're not paying attention to. If you don't understand, you're not receiving that information. But again, that person that's speaking can't tell that. And so they'll say, you just don't listen. you don't pay attention, you don't do the job, and I've told you about this many times, and that people have lost their job over that issue, or they don't get the raise or the new promotion, and it's all related to that. I'm going to tell you this, if you're 50 years old or 40 years old or 30 years old and you have hearing problems, you can't afford not getting help with hearing. If you're 60, 70, 80 years old and you say, I'm too old to get help with my hearing, do you really want to be able to hear and understand people? Do you want to understand the most precious, important parts of your life? I'm going to end you this story. My father had done quite a few different jobs in charge of these $8 billion programs. It's a long story related to that. And he has an amazing career. But let me tell you what he actually said that he regretted more than anything else, is he didn't spend as much time as he wished he had with his son and his 2 daughters. Wait a second, that was what he regretted, that communication that he didn't have. It's not just about spending time and being there in silence, it's that communication that happens. Do you want to regret that? Do you want to live a life of fullness and explain the things that are important to you? Do you want to make the money that you need to be able to make and move into that new job? There's never too young and there's never too old to get help with your hearing. So come and check us out. It's at Hearing Solution Centers or HearTulsa.com, and subscribe anytime you can. Thank you so much.